Welcome to the Unpacking Poverty colloquium on food insecurity. I'm Dr. Robert Balfance, research professor at the School of Education, Johns Hopkins University, and director of the Everyone Graduates Center. Our narrators today will be Danielle Princiati and Richard Lofton from the School of Education, Johns Hopkins University.
Hello, my name is Richard Lofton. I would first like to start off by explaining a few terms that are used to help describe and analyze food insecurity and malnutrition. In 2006, USDA introduced language to help describe ranges of food insecurity. Food insecurity is a social and economic household condition where there is a limited amount or uncertain access to adequate food. Food insecure households are classified as having either low food security or very low food security. Low food security is the reduced quality, variety, or desirability of diet, with little or no indication of reduced food intake. On the other hand, very low food security is when a household has multiple indications of disrupted eating patterns and reduced food intake. The Food Research and Action Center, which is the leading national nonprofit organization working to eradicate hunger and malnutrition in the United States, uses the term food hardship to describe when a household in the past 12 months did not have enough money to buy food. Hunger is an individual level physiological condition that may result from food insecurity. It is the craving or urgent need for food or certain nutrients. Now that I have given a few definitions on key terms, some may be wondering how many people are confronted with food insecurity. USDA is estimating that 49 million people in the United States are living in food insecure households, and nearly 16 million children are food insecure. 14.3% of the United States households suffer from food insecurity during 2013. Over a quarter, 26% of Black and around 24% of Hispanic households were food insecure. Around 6% of U.S. households, 6.8 million families, were very low food insecure. 10.1% of Black households and 6.7% of Hispanic households were very low food insecure. Therefore, a little over 10% of Black and 7% of Hispanic households were missing multiple meals or not obtaining adequate nutrition. We also can see that food insecurity is more common in large cities and rural areas, but we are also discovering that since 2000 it is spreading to the suburbs. 1 out of 5 children are growing up in food insecure families. Half of those children are experiencing food insecurity themselves. While food insecurity is more common in large cities and rural areas, people who are below the poverty line are more likely to have to confront food insecurity. This graph shows the percentage of children in food insecure households by the federal poverty line. 46% of the households below the poverty line are faced with food insecurity, compared to 32% in households that are at 100 to 100% of the poverty line. 8% are in households that are above the 200% federal poverty line. In very low food insecurity household where people eating patterns disrupted, we can see that 3.4% of the households that are below the poverty line and 2.2 are at the poverty line or 200% above the poverty line. One of the points we are trying to make with this slide is that the further away a person is from the poverty line, the better chances the person will not have to deal with food insecurity. While the research is informing us that some households in the United States are struggling with poverty and food insecurity, we also wanted to show some of the conditions that these families are confronting. Almost 100% of very low food secure households worried that their food would run out. 98% reported that they bought food, but it was not enough. And 94% reported that they could not afford to eat balanced meals. Households without children classified as having very low food security reported 6 or more food insecure conditions on this chart, and households with children reported 8 or more food insecure conditions. We can also see that low food insecurity households are not exempt from these conditions. They are facing some of the same struggles. Many of these households worry about food. They eat less and they cannot afford balanced meals. In addition to being confronted with different conditions, we also discovered that people in these homes have to make different choices than people who are food secure. They often have the hidden burden of choosing many factors in order to obtain food to survive in this world. It was very important for us to unpack some of these choices. For example, almost 70% have to choose between food and utilities. This made us think that some people were choosing between paying their gas bill, their light bill, or other bills that they have to be confronted with. In addition, 66% have to choose between their medical health care and obtaining food, and 57% had to choose between food and housing. Not only did food insecure people have to make different choices, they also have to develop coping mechanisms to obtain food. Almost 80% ate inexpensive and unhealthy food, and 53% received help from family and friends, and 40% watered down food and drinks. The people who are making different choices and developing coping mechanisms because of food insecurity are often in concentrated areas. This is clearly the case for African Americans. We discovered that 93% of the counties where the majority of residents are African American are in the highly food insecure category. Of the counties where a majority of residents are Native Americans, 62% belong to highly insecure areas. In contrast, 6.2% of the majority of white counties are in the highly food insecure group. This research is showing us that African Americans are overwhelmingly clustered in food insecure counties. Sometimes, some consider this the double burden because not only are they individually confronted with food insecurity, but also many members in their community are struggling with the same conditions, choices, and coping mechanisms. In much of the conversation so far, we talked about the issues within homes and communities, but we also found that food insecurity impacts the interconnected web of home, communities, and schools. For example, we discovered that food insecurity at kindergarten predicted impaired academic performance in reading and mathematics, decline in social skills for boys in school, and greater weight and body mass index for girls. Students who are 6 to 11 years old has lower math scores, more likely to have repeated a grade, more often have seen a psychologist, learn less during the school year, and difficulty getting along with other students and difficulties with self-control. But not only did we see differences in education, we discovered differences in overall wellness of children who are confronted with food insecurity. 4 to 36-month-old children from low-income households with food insecurity were more likely than those from low-income households with food security to be at developmental risk. So households with low income and food insecurity, their children were more vulnerable to be at developmental risk. This also has an impact on health. Children who are more likely to experience poor health if they experience food insecurity as toddlers. Research is also suggesting that the poor and food insecure children are especially vulnerable to obesity. In addition, many of these children lack the necessary vitamins and minerals like vitamin A, magnesium, protein, zinc, and phosphorus. I'm going to turn this over to Dan now.
Now that we've heard the big picture of food insecurity in the United States, and a little bit about the impacts of food insecurity on children, both in terms of their academic outcomes and also their health and well-being, we're going to delve more deeply into the geography of food insecurity. What we tried to do was to zoom in from the national level down to the state level, to the metropolitan statistical area level, down to congressional districts, counties, and schools. And we did this by looking at a series of data sources, including data from the USDA, FRAC, Feeding America, and the Early Childhood Longitudinal Study. Now, as we zoomed into the county and the school levels, things started to get a little bit more pixelated. At the county level, there are only synthetic estimates that are available, based on a model that was developed at the state level and then applied at the county level. And as a result, we think that the county level synthetic estimates demonstrate less variation than the actual variation that we would see at a county level. And at the school level, while there are estimates from the early childhood longitudinal study, that these estimates are just based on a sample of schools and that there are not estimates available for every school in the country. Okay, so this slide provides us with information on the food insecurity rate in households with children at different levels, from the state level all the way down to the public school level. Now, there's a lot of information in this slide. So first I'm going to sort of walk us through this first row here, which has state level estimates of food insecurity from the USDA. You can see that these estimates are based on data from 2003 through 2011. And what they're doing is they're aggregating data from multiple years so they can get precise estimates at the state level. And that's something that we see from various data sources. We see that the median food insecurity rate for states was 17%, and that this ranged, however, from 11% to 24%, with 20 states having food insecurity rates that were above 20%. Now, the most important thing to draw from this slide is that as we move from the state level down to the MSA level to districts, counties, and schools, the range is increasing. Right? So whereas states range from 11 to 24%, according to the USDA, at the MSA level, we see ranges from 14 to 32%. At the district level, we're seeing ranges that are much bigger, and so on down to the county and the school level, where in schools we're seeing a range from 0 to 48%. And so what this is telling us is that if you're only looking at food insecurity at sort of a higher level, it's going to be masking some of the variability. And we really want to see how much we can explain in terms of food insecurity at a very granular level, because different levels of food insecurity necessitate different strategies to try to address the problem. So this map is food hardship rate by congressional district. This is a map from FRAC, and it's based on sort of their question that they use to get at food hardship, which is, have there been times in the past 12 months when you did not have enough money to buy food that you or your family needed? And as you can see on this map, there's a real concentration of food hardship in the South and the Southeast, and also in some areas of California. On this next map here, which is from Feeding America's map, the Meal Gap Study, we can see child food insecurity rates by county. And I apologize that the scale is different, that the color is a little bit different, but this is pulled directly from the source document. What you can see when we zoom into the county level is that there's actually a number of areas with food insecurity rates that are 30% and above that we couldn't see on the previous map that wasn't as granular. So we can see again that the South, the Southeast, there are a number of areas with very high levels of food insecurity among children, but we also see it now in the Southwest, in the inland Pacific areas, and even in parts of Alaska. So when we looked to see whether there was data at the school level on food insecurity, we didn't see a lot out there. What we were able to do, however, was to generate our own estimates using data from the early childhood longitudinal study, kindergarten cohort of 1998 to 99. And this is a nationally representative survey put out by the National Center for Education Statistics. And the great thing about the survey for our purposes is that in its base year, because of the sampling design that they used, it's not just representative of students nationally, but it's representative of schools serving kindergartners. So what we found was that among public schools serving kindergartners in 1998-99, the average school-level food insecurity rate was 10% among kindergartners. We also saw, as we discussed earlier, that it ranged from 0 to 48%. And on the right-hand side of this slide, you can see a histogram which shows the percent of public schools serving kindergartners by various rates of food insecurity. So one thing to keep in mind with this data from the Early Childhood Longitudinal Study is that it's pretty old. There is new data out for the ECLS from 2011, but it's not publicly available yet. So we're basing our estimates on data from the late 90s, and as you can see on this slide from Child Trends, in 1999, that was one of the years with the very lowest rates of food insecurity among households with children. This is the boom time of the late 90s, versus today in sort of the post-financial crisis of 2008 period, things look a little bit different. So the estimates that we're going to be talking about from the ECLS are very conservative, both because of the time frame from which they're drawn and also because of the sample that was used. But even given this, imagine a classroom of 30 students. The average food insecurity rate according to the ECLS was 10%. So that means that 3 in 30 students would be living in food insecure households. 42% of schools, or about 20,000 nationwide, had a food insecurity rate at or above 10%, according to the ECLS. Now, there's about 13% of schools, or 6,100 nationwide, that had a food insecurity rate at or above 20%. This would mean 6 out of every 30 kids would be food insecure. And there's actually 5% of schools, or about 2,200, that had a food insecurity rate at or above 30%, which means 9 in 30 students in these classrooms on average would be living in food insecure households. And it really gets you thinking about what the impact of food insecurity could be on learning, not just for individuals, but also at the classroom level. So the other way to look at this is at the school level. So this slide posits that we have an elementary, a middle, and a high school with serving 400, 800, or 1,200 students respectively. And it sort of maps out how many kids would be food insecure in each of these schools or in a school of this size, depending on the level of food insecurity at that school. So for an average school with 10% food insecurity rate, that would mean about 40 kids at a 400-person elementary school, up to about 120 kids at a 1,200-person high school. When you look at sort of very high food insecurity rates, that 30% estimate that about 5% of schools nationwide are facing, you see that in a high school with 1,200 kids, you're looking at 360 food insecure children. And again, at the school level, you can see that this could potentially have substantial impacts. So let's delve more deeply into the impact of food insecurity on student academic outcomes. Dr. Balfans calls this the learning tax of food insecurity. So one recent study based on the Early Childhood Longitudinal Study found that for kids who became food insecure between kindergarten and 3rd grade, they had decreased reading gains. And the effect size for this was relatively large. It was about 0.2 of a standard deviation, which translates into losing roughly 70 days of learning relative to the average learning that takes place in reading across grades K through 3. Just to put this in context, the magnitude of this effect is similar to that of the Tennessee Star class size reduction policy, but in the opposite direction. So the last slide focused on students who fell into food insecurity. And this slide looks at all students who were food insecure at some time from kindergarten through 3rd grade, either starting out food insecure and remaining food insecure, starting out food secure and becoming food insecure, or vice versa. And when we include all of these students, we see an effect size that's roughly half, a little bit under half of the effect of students who become food insecure from K through 3, where they're looking at reading gains that are about 1/10 of a standard deviation lower than food secure students. So when we look at school level effects, aggregating the effects across students who are food insecure and students who are not, we see that in an average school that they would be losing 5 learning days from kindergarten through 3rd grade. And a high food insecurity rate school, we're looking at the loss of 10 learning days, and in a very high food insecurity rate school, we're looking at a loss of 15 learning days. from kindergarten through third grade. So while there are impacts at the school level, the good news is that there are also solutions that are existing programs at the school level. However, a lot of them are underutilized. We know that only half of food insecure households with children who were eligible for SNAP or food stamps were actually enrolled in the last 30 days. We also know that on an average day, almost 11 million students who are eligible for free or reduced priced breakfast are going without it, and that just 1 in 9 students who received free or reduced price meals during the school year receive them in the summer. So there's some low-hanging fruit in terms of potential solutions around increasing the uptake of publicly funded programs that are currently not being fully utilized. For example, we know that SNAP works, so schools can help increase outreach to parents, even signing parents up via school or via community partners who are engaged in the school. Schools can work to boost participation in the free and reduced price meals program through things like direct certification, where students are automatically certified for free or reduced price lunch based on their parents already being certified as eligible for temporary assistance for needy families or for SNAP. Or things like community eligibility, where if a certain threshold percentage of students in the school are eligible for free lunch, then all of the children in the school become eligible. And through things like universal breakfast programs or breakfast in the classroom, where instead of kids having to go to the cafeteria to pick up their food in the mornings, they can actually get served a breakfast in the classroom at the start of the day. The other thing schools can do is have summer food programs located on site over the summer. Let's delve a little bit more deeply into school breakfast as an example. We know that there are things that states can do as well. 27 states require school breakfast for some schools. 5 states require school breakfast for all, and 4 states offer no-cost breakfast to reduced-price students. FRAC took a look at the 12 top large districts with respect to free and reduced-price breakfast. These are districts that had ratios of free and reduced-price breakfast to free and reduced-price lunch usage of 66 and up. And each of these districts offered breakfast free to many or all of their students, and each had a breakfast in the classroom program in at least a third of their schools. But solutions don't just involve tapping existing programs. It also involves changing practice and also changing perceptions. We really need to act on the finding that food insecurity impacts student success not just directly, but also via family stress. We know that parents are going hungry to feed their kids first, but we also know that this is still having negative impacts on children. We also see that the need to address food insecurity varies by place, even within high poverty communities. And one of the things that school districts or cities can do is to survey families within their boundaries so that they can make sure to target solutions to the right schools and students. In the most impacted schools, we can use schools as a location to increase food resources to the family and not just the student. Around the country, we're seeing a number of schools partnering with emergency kitchens and food banks to implement programs like backpack programs where kids can bring backpacks filled with food items home over the weekend, and things like school pantries where kids and their parents can pick up food if they need it. The other thing that we need to recognize is the intensity of need in a wide swath of high poverty rural counties in the South, Southwest, and Inland Pacific regions. We need to consider regional solutions to this intensity of a place-based problem. And so now I'm going to turn things over to Dr. Balfance for some of his concluding thoughts around food insecurity.
So in conclusion, what we've learned about food insecurity is that it's an economic stressor on the entire family, not just on students. And this is a very important insight to think about because we often try to solve for food insecurity at the student level on the assumption that it is the student who is hungry. That is the case as we have seen in our data, and when that is the case, that is a problem that needs to be addressed immediately. But the broader issue of food insecurity is when the family in which the student lives is food insecure. And it's been found that even in that circumstances, that has impacts on the student's school achievement. And that tells us that we have to actually address the family's food insecurity, not just the students. And that leads us to think about our solutions in quite different ways. We also found that food insecurity rates vary. It's not the case that just if you receive free and reduced price lunch that some percent of kids uniformly are food insecure. It will vary depending upon where you are and what unit of analysis we're looking at. And as we get to a smaller level of unit of analysis, the variability increases. We found that this is an issue in urban areas for sure, but there are rural counties, especially in the South and the Southwest and the Inland Pacific, that are highly impacted. And at some level, one could see as even a more challenging solution when multiple counties in the same area are all food insecure. It's hard to often imagine that they themselves can solve this by themselves. We have seen that families who are faced with food insecurity often have to make difficult choices and develop coping mechanisms to secure food. And this is some of the spillover effects, which this then shows that not only do they have the direct physical effects of hunger, but it increases stress in the household as far as making decisions about will we water down our food, will we skip a meal, or will we skip something else? And just the energy it takes to make that decision and the stress associated with it has its own impacts both on the family and through them on the student. And as we have seen, food insecurity has real impacts on students' academic performance, wellness, and interpersonal relationships. It's not just a fleeting thing where you are for a brief moment in time hungry and then it passes and you are fine. It is that there are quite lasting and impacts that last over time. That students that are food insecure early in school are still showing effects through adolescence and beyond, even if they are not, even if by adolescence they are no longer food insecure. And we've also seen that this is one of those areas where viable solutions exist. We want to conclude with a tool we're working on to develop in this series, which is a way to just summarize what we think is this as we unpack poverty, and on this issue, food insecurity, that looks at the issue by its impact, its variability, and its solvability. Just trying to answer, is this something that matters to student success? Is this something that varies a lot from place to place? So we have to really understand where we are to understand the challenge and not just to be able to assume that all students that live at a certain level of poverty face this challenge at the same level. And how solvable is it? Because really our goal in the series is to get to solutions by first unpacking poverty and laying bare the extent and intensity and location of its challenge to give us insight into better solutions. So having done that for a domain like food insecurity, we conclude by saying, where does this fall on our solvability scale? So for food insecurity, we found that at the individual level, for students that are themselves food insecure or live in food insecure families, that it's highly significant in terms of student outcomes for those impacted students. When we kick this up to the school level, we would argue it's more modestly significant for the impacted schools, those, for example, in which 20% or more of students are food insecure, which is a smaller subset of schools, though still not insignificant in number. We find this is a domain of poverty that is highly variable by place. It is really a subset of schools with substantial food insecurity. It is not all schools. If you looked at all schools with 50% or more free and reduced price lunch, you would find variable levels of food insecurity within those schools. On the solvability side of things, we believe this is, in a broad sense, highly solvable because we are able to both target with better data and better understanding to the subset of schools with the highest levels of impact. And it is a domain, as we have seen, where some practical solutions exist. We're not arguing we can get rid of food insecurity, but we are arguing there are clear ways to modify and mitigate its impact on student success. The challenges in getting there are getting the resources that are available to where they're needed at the scale required, and then being able to implement those solutions in schools that are facing high levels of stress and scarcity. So it may seem straightforward to be able to implement a school breakfast program, but the basic logistics of being able every day to get those food into the building and from the building to the classrooms and to the students in a regular and non-disruptive and consistent way brings with it a set of challenges that in a highly resourced school with lots of adult capacity would not be a challenge, but in a highly impacted school facing lots of stress and scarcity can be a challenge. And so the solution is not simply to say, sign people up for breakfast programs, but it's sign them up and solve the logistics of making it implementable on a consistent level, given the realities of the environments in which those schools exist and operate.